I'm sure some of you came across this news before, and I think with this, it may change the nature of the fundamental cause theory and the stigmatization of illness. So, I don't know how large is the audience for this news, and I'm not sure who will see this news, whether it's high income people, moderate income people, or low income people, or whether it's highly educated folks, or those with less education, or whether it's those with white collar jobs or blue collar jobs. We don't know, because this is still posted on the internet, so we are not sure who is going to come across this and who is going to understand the findings. So because of that, in my humble opinion, with this new scientific finding, I think it is going to change how we view the fundamental cause theory. Because the internet can reach a lot of people, we all know. So this is the basic framework of the fundamental cause theory. It says that our socio-economic status, be it our income, our education, our occupation, and so on and so forth, is going to affect the level of health protective resources we are going to have, and is going to also affect the level of health enhancing resources we are going to get. Our socio-economic status is going to also affect the quality of healthcare through the type of insurance we either get through our employer or the type of insurance we can afford. And our socio-economic status can also affect our neighborhoods, the kind of neighborhoods we are going to live in, the kinds of residential areas we are going to live in, and our socio-economic status is going to affect our social support systems. And through these social support systems, it can be the groups we join in our community and neighborhoods. It can be the religious organizations we join. It can be our neighbors, our friends, our families, if they also happen to live close by or in the same neighborhood. And all these individuals can serve as outlets for stress relief, and they can also be a source of social support to us. And these in turn, by interacting with those around us and through the other mechanisms, this in turn is going to affect our health literacy or our health knowledge on how much we understand or understood the findings. And the level of our health knowledge can affect our health behaviors, and the level of our health knowledge can also affect our attitudes towards others, and the level of our health knowledge can affect our attitudes towards another person, and this can alter the nature of how a given illness or disease is being stigmatized. In other words, this can change the nature of the stigmatization of disease or illness. And our health behavior in turn can determine our health outcomes, different health outcomes and health conditions. So, because of these research findings, in my humble opinion, I think it can change the nature of the fundamental cause theory, and it can also change the nature of stigmatization pertaining to coronavirus. Have a good day.